Hi guys, I'm Dr. Sankara here. Hope everyone is doing well. Okay, a few of my patients have asked me regarding cancer screening. So this is a very interesting topic. So cancer screening, that means when you have any symptoms in regards to cancer, then we will send you for screening. For example, you're having loss of weight, loss of appetite, probably any pain or PR bleeding, diarrhea and all this thing. Then if we suspect you have cancer, then we will send you for screening. And then you have to check for risk factor as well. So if you're a smoker, of course you're susceptible to many type of cancer, especially lung cancer. You have to screen for that. Even though you don't have any symptoms, then probably you need to do screening, regular screening. If you have family history, strong family history of cancer, especially colon cancer, then you have to do screening. For colon cancer, of course, you need to do a regular scope of 3 years. If your dad or your grandfather or grandmother or auntie, uncle have this type of cancer, you have to do a regular scope, OGDS or colonoscope screening. Alright, then for women, the most common thing is of course the breast cancer. I would really encourage you to do frequent mammogram even though you don't feel anything. At least 3 years once is quite sufficient for breast cancer screening. Okay, so in case they can detect anything also, it will be very early so they can do something about it. So now coming back to me, how do you just say you don't want to do all this? How to go about it? So the next step is cancer markers. Cancer markers is something which you can check through blood. You can do it any clinic. So you can do it together with your normal blood screening. Okay, cancer markers, there are many types. Here are a few types. So here are some of the most common cancer markers. If any of these is elevated, then we have to suspect cancer. So as you can see, many type of blood tumor markers. Okay, so we don't have to do everything, but what is my suggestion, just do the most important one. So I divide the two groups, for the guys and for the ladies. For the guys, of course, you need to do a few things: the AFP, the CA 19.9, and PSA also. PSA is for your prostate. Okay, prostate what is this, is a marker for prostate cancer. And then you have the CA 19.9 is the marker for pancreas cancer. Then you have the AFP. AFP is mainly for liver cancer. Then you also raise for any other cancers as well as like testicular cancer. Then you have the CEA. CEA actually is a very non-specific cancer marker. It raises for many type of cancer, mainly for colon, gastric, lungs, breast, and all this sort of cancers. For female, of course, we have a bit more to do. We do the usual AFP, CA, and CA 19.9, but you have to do the CA 12.5, which is for ovary cancer, or you can detect for breast cancer as well. But CA 153 is the one which is very specific for breast cancer. Okay, anyhow, even you might have a small growth, sometimes the markers will not raise, and then even if it raise, it might not be cancer also. So it has a drawback for these blood tumor markers. But otherwise, if you're doing a blood group, I totally recommend just to do this cancer markers. So if there is anything, we can try to detect early and try to do something about it. So it is really useful. So this is an example of my patient, the picture I'm going to show you after this, of her cancer marker. So this person have done 3 markers: CA, CA125 and CA 15.3, and all 3 is within the range, so it is a normal result. So guys, so that's about it. If you really like my videos, please subscribe to my channel, and I will see you in the next video.